Hi, my name is Greg Thompson. I'm the Executive Director of PASC, and welcome to our monthly Tele Town Hall. I would like to thank all of you that have joined us this evening and urge you to stay on the call. Tonight we have some great presenters, and we're going to be giving you some important information. So if you would like to take the next few minutes while I'm kind of talking about how the call works to grab something to write with, pen, paper, it might be a good idea so that you can jot down some of the information that we're going to be giving you. However, don't worry about it if you can't get it all down. You can always call us back at PASC. At any time, if you'd like to ask a question with one of our screeners, just hit *3 and you can ask a live question, hopefully. Also, now would be a good time if you're near a computer. You can join us online at www.pascla.org. I'll repeat that one more time. www.pascla.org, and you click on the Join Us Online link. The cool thing about this is that online participants, you'll be able to get the PowerPoint presentation and kind of follow along with us, and you won't have to try to write down all the websites and various phone numbers and information that we give you. As usual, after each one of our presenters tonight, we'll open the lines up and take questions from you. And to ask a question again at any time during this call, press *3 on your telephone. And if you're an online user, you're just going to type the question in the question box and then click Submit. You can do this at any time throughout the call, and then just listen for your name during the question and answer session. Once again, to ask a question, press *3 or type the question into the question box if you're following us online. We'll try to take as many questions as time permits. And for those of you that don't get asked your question live, we will have a PASC peer mentor call you back and give you the information that you requested. During the live question and answer session, we're looking for questions that relate to the topic that we're discussing. I know there's a lot going on, and all the questions are important, but tonight we're going to be looking specifically for questions that relate to what the presenter just talked about. If you have a different question or different topic, of course, at any time you can hit *3 and let the screener know your question, or at the end of the call, or any time you can press *9 and leave a message after the call. We're going to do the other thing that we like to do. We'll be asking you several poll questions during the call, 3 to be exact. This is where we'll ask you a question, and then you'll answer by responding to the answer by pushing a button on your telephone. And this is very important to us because it gives us an idea to know how we're doing, and it also gives you a chance to give us, lets us know if we're hitting the right points in the discussion. And some of them are questions about how you feel about a particular topic that we're talking with. And these poll questions are really simple. I read the question twice, and then you'll just hit the appropriate button on your telephone, or if you're online, the online users will answer by scrolling down to the bottom of the screen and expanding the question. You'll see the question, you expand that box, and then you just select the circle next to the answer. So here we go with our first poll question. My doctor or medical provider billed me for something I thought Medi-Cal or Medi-Cal should have paid for. Press 1 for yes, press 2 for no. Again, my doctor or medical professional billed me for something I thought Medicare or Medi-Cal should have paid for. Press 1 for yes, press 2 for no. I want to thank you for taking the time to, answer our poll questions, because as I mentioned earlier, they are very important for us, and this information is very helpful, not only for us, but for the presenters we have tonight. Janet, are you on the line?
No, unfortunately, Janet couldn't make it tonight. Let's tell us how that open house went.
All right, I'm going to be Janet. I'm Miss Cannonberry for the next minute. If I was really Janet, it would be 5 minutes. But I'm going to try to do it in a minute. I hope you heard that, Janet. What Janet was going to talk to us about was the What Janet was going to talk to us about was our open house that we held last week at the California Endowment. And we had about 237 to 240 people show up. We do this every year. We're very fortunate to have several agencies come and exhibit the work that they do. A couple of representatives are here today. We also had the 5 Cal Medi-Connect health plans there, and they did a wonderful 5-panel discussion where people were able to ask questions about the health plan and about Cal Medi-Connect. We all know how simple and easy it is to figure out Cal Medi-Connect, but it was still very helpful to have the health plans there. I mean, seriously, we're almost 3 years later, we're still trying to figure out what the heck's going on with Cal Medi-Connect, and do you opt in, do you opt out, are you covered, are you not? So it was really good to have them there. We had some people were able to talk to us about our services. We had the Department of Public Social Services there, and they were able to field questions. And again, I want to thank Janet and Rebecca from PASC and all of the staff. Layla was also very instrumental in putting it together, so thank them for that. So I hope I got in under 4 minutes. And we do miss having Janet on the call. She's always very informative and much more elegant in her presentation than I am. So now I think it's time to introduce our first guest. And as for those of you who just joined us, our Tele Town Hall tonight, we're going to be talking about balanced billing. And anytime during the call, if you have a question, just press *3, and you can talk to one of our screeners and then hopefully ask your question live. And you can press *9 before hanging up and leave a recorded message. Now I would like to introduce our first presenter, Denny Chan from the Justice League. I mean, I always call them the Justice League, but they're really Justice in Aging. And they've done tremendous work in Los Angeles and in other places, obviously. But we're so happy to have you here, Denny. So thank you very much for being on the call. Maybe you could tell us a little bit about Justice in Aging.
Great. Thank you so much, Greg. My name is Denny Chan, and I'm a staff attorney at an organization called Justice in Aging. We used to be called the National Senior Citizens Law Center, which some of you might have known us before under that old name. But we're a national nonprofit legal organization that is dedicated to fighting senior poverty. And we fight senior poverty using the law, and so we do that in a couple of different ways. We do that through policy analysis. We do that through impact litigation when we bring large class actions on behalf of many different low-income seniors. And then we also help people who work with seniors and other people with disabilities as a backup center. I should say, just to note, that we don't provide direct services, so we wouldn't be able to help individuals with their specific issues, but we'd be able to make the appropriate referral if need be. I sit on our healthcare team here in Los Angeles, where I work mostly on issues affecting people with both Medicare and Medi-Cal. And one of the issues that we've been working on the past year or so is this issue of balanced billing. So I'm really excited to have the opportunity to come here and talk to you guys more about it. Thank you so much for having me.
Well, it's our pleasure, and I'm curious about this balanced billing. I always thought, when I hear balanced billing, I always thought that was a good thing. You know, I always try to balance the budget here, but I guess in certain circumstances, it's not always the best thing. So thank you, Denny. We're glad to have you. Also with us tonight, we have David Kane from the Neighborhood Legal Services Center. Let me start over again. David Kane from the Neighborhood Legal Services. David, we're also very glad to have you here tonight. and I'm hoping you can tell us a little bit about what you and your organization do.
I'd be happy to. Thanks, Greg. I'm so excited to talk with you all tonight. I'm an attorney also at Neighborhood Legal Services, and unlike Denny's organization, our entire mission is to provide free legal services to anybody who lives in LA County. We focus on access to health care. So if you have any problem with your health insurance, seeing your doctor, getting a denial from a health plan, you can call us. We run a hotline, and we can provide you with assistance. And one of our biggest focuses right now is helping consumers with bills that they shouldn't have to pay. And so I'm very excited to talk to you all tonight about how we can work together to solve that problem.
Great. Thank you, guys. We're really glad to have you. So those of you who might have just joined the call, tonight we're going to be talking about a thing called balanced billing, and Denny and David are going to be able to enlighten us about that. If you have a question at any time, please press *3 on your telephones, and if you're following us online, you can ask us a question in the question box at the bottom of your screen. So we have this thing called balanced billing, and I'm not exactly sure what that is. As I mentioned earlier, I thought it was a good thing to balance my bills, but maybe it's not. So which one of you guys wants to give us kind of a summary of that?
Great, I'll start.
Okay.
So balance billing we think is actually not a very good thing, unfortunately. What happens is balance billing is when a person who is on Medicare, Medi-Cal, or on Medi-Cal gets billed for something they thought should have been paid for.
That's right. It's when you think that Medicare or Medi-Cal should be paying something, but your doctor or hospital sends you a bill anyway, that could be balance billing. And these types of bills, we want you to know, are illegal. They could violate both state and federal law.
That's right, David. So there's a lot of different protections out there in place to make sure that people who have already been determined that they're too poor to pay these bills, they're low income, they shouldn't have to pay. And so when you get a bill, it is highly probable that there's a violation of either state and or federal law and regulations.
And these types of bills, they can come in all different kinds of amounts. It could be a small copay as little as $5 every time you go to the doctor, or it could be a huge bill that you are hit with after you go to the hospital of maybe thousands of dollars.
And not only do the bills in terms of the amounts vary, but who does the billing also varies. So I think we traditionally think of balance billing in the doctor's context, right? So you go to see your doctor and he bills you a copay or some amount before you can see him or after you see him. But balance billing can occur in a lot of different contexts. So we can have hospitals who balance bill, we have labs who balance bill, or pharmacies. So it's really important that when we think about balance billing, we're thinking about all the different types of medical providers there are out there.
That's right.
So I think I have an idea who's balanced and who's bills here, and on whose backs they're being balanced. Thank you for that explanation. And is there anything that's happened recently that's triggered that? What sort of brought this balance billing to light?
Good question. I think Denny is in the best position to answer that.
Great. I would say, that balance billing has been around for a long time. People who, especially for people who have both Medicare and Medi-Cal, these two systems aren't used to talking to each other, right? And so when Medicare is the primary payer, but then Medi-Cal is supposed to pay for some things, there's some confusion that inevitably happens during that process. And sometimes doctors get confused or other providers get confused. I will say that, one of the times that we saw an increase in balance billing was with the CCI, with California's Coordinated Care Initiative. And what happened was a lot of people, they, decided not to join CalMedi Connect, which we talked about during the open house, and instead had to pick that Medi-Cal plan. And when they were put in that Medi-Cal plan, suddenly they had some bills, right, that they weren't getting before. And so I think every time we see some sort of new change, some sort of systems change, there's the opportunity for confusion. and there's the opportunity for people to get these kinds of erroneous bills. The other thing I'd say, too, is that for people who are calling in, because we're talking about health insurance and health insurance bills, and that's inherently such a confusing thing, that if you're talking to a screener, you should make sure to have all your health care cards out, just so that we know and we can sort of easily pinpoint which of the protections you might fall under.
Great, thank you. Well, Julie's going to be looking up, see if we have any callers queued up. It seems to me it's probably a good idea that anything that looks unfamiliar on your bill, it's okay to question that.
Absolutely.
All right.
Maybe what we could do is walk through a hypothetical.
Do you have any questions?
We have questions.
Oh, okay.
Hold that thought, though.
Sure.
We'll take a couple questions, then we'll do the hypothetical.
We're gonna go with Daniel.
Hey, Daniel. Welcome to the call. Do you have a question for us?
Yes. I moved from Kern County to LA County with my provider, and I rented a room from his mother in their house. He became abusive. I'm now in therapy. My therapist says that I have civil rights violation. I have elder abuse against him. He's committing fraud against the county.
Wow, it sounds like a lot's going on. I'd like to maybe take this offline and call you back as probably as early as tomorrow, so we can see if we can get you some help, assistance with that. Thanks for bringing that up, though. So, Julie. Georgia.
Yes.
Question for us. Welcome to the call.
Thank you, sir. Yeah, I was talking about Medicare and Medi-Cal, and I got a letter the other day, and my caregiver had to read it to me because I'm blind. And I was saying that on that scam, I don't know how to pronounce it, sir, but I'm doing my best. That if I'm on Medicare and Medi-Cal and I have HealthNet, can they take me off my HealthNet?
That's a great question, Georgia.
Thank you, sir.
You gentlemen want to give it a go?
Sure. Georgia, if I am understanding your question correctly, you've got both Medicare as your insurance and Medi-Cal as your insurance.
Yes,
but
sir.
Your Medi-Cal's with HealthNet, is that right?
Well, I have Medicare, Medi-Cal, and HealthNet, and that's all I know, sir.
Okay. Well, if it is what we think it is, if you have your Medicare as regular Medicare and your Medi-Cal's with HealthNet, under that whole Cal MediConnect thing that Greg was talking about, there's a requirement that you have to have a plan assigned to your Medi-Cal.
Don't know what all that means, sir.
Medi-Cal.
But if nothing with your circumstances change, you shouldn't be kicked off the program.
What program, sir?
Georgia, was your concern that you would lose your HealthNet coverage?
Yes, sir.
So you want to stay with HealthNet, correct?
Oh, yeah, yes, sir.
Okay. I want to take another run at she can stay with HealthNet.
Absolutely.
If she could.
If you got your Medicare and Medi-Cal and that's still working, Georgia, you should not have to switch out of your HealthNet insurance.
Could I ask you one more question, sir?
You shouldn't have to. And if you have any questions, you can always give us a call. We're going to share our phone number a little bit later.
Well, sir, can I ask? I'm sorry.
Yes, because I like you, I'm going to let you answer one more question.
Yes, sir. Yes, I'm totally blind, and I need a rail out here in front of my porch. I was promised by, Medicare and Medi-Cal and other people up there in Los Angeles, but nobody's helped me, sir, and I've been falling a lot on the porch. And they promised me a rail.
George, I'm sorry to hear that, and you don't have to call me sir. Next time you call me Greg, please.
Oh, I'm sorry, Greg. I'm sorry.
That's okay. You don't need to apologize either. We're just happy to have you on the call. I think maybe one thing, Abby, you could try HealthNet, and if they're not able to get that rail out, I'm thinking maybe one of the high cap or one of you gentlemen would, okay. David says he's more than willing to take your call, so we're gonna let David give you his phone number.
I can't take it. I can't take it down
Sorry.
because I'm blind.
I understand. I apologize for that.
Oh no.
We will get you that number. I have your telephone number because you called into us, and so we're gonna figure out a way to get you two guys in touch. Okay?
Thank you very much.
Thank you for calling.
Thank you.
Carrie.
Carrie, do you have a question for us?
Actually, Julie answered most of it for me. I think it was Julie that I spoke with. But I had previously, before they did the CCI, when I had both Medicare and Medi-Cal, but they weren't, my plan was just for Medicare. And I had gotten some billing from some various different sources, all of whom, but for an ambulance bill, told me, when I was filling out the paperwork and et cetera, they were, I always ask if there's a copay, especially on unusual procedures and whatnot, and they all did, said there was no copay, and then I got what sounds like possibly a balanced billing bill, one of which was for the specialty pharmacy for Synvisc injections. And when I went for subsequent injections, the pharmacy refused to fulfill the prescription because of the previous unpaid whatever that I didn't even know I was supposed to be paying.
Thank you for sharing that with us. I'm sorry that happened, but that does sound like balanced billing, and we're going to try to give you a solution, hopefully.
Carrie, I just want to ask you to make sure right now, are you still in need of getting those injections, or have you been able to get them?
She's probably, sorry, we disconnected her, but the way I understood the question, Denny, is that she had the first suspicious billing was the ambulance, and then when she went to get the prescription for the injections, they refused to give her the injections because she had not paid for the ambulance.
Right. So it sounded, and I didn't hear all the details quite carefully, but it sounded like she possibly could have been in the Medicare Advantage plan. She had mentioned about being in a plan for her Medicare. And what's great about being in a Medicare Advantage plan, there are a lot of benefits, but one benefit when it comes to balanced billing is that there are extra protections for people in a Medicare Advantage plan. So if you are dual eligible, if you're what we call Medi-Medi, and you're in a Medicare Advantage plan, you shouldn't be paying any co-pays, whether it's for the ambulance, whether it's for the injections, whatever it might be, you shouldn't be paying them. The only exception I'd say is if you're visiting a provider that's out of network. So if it's not an MA plan provider, that they're not contracted to work with that MA plan, that would be probably the biggest exception. But assuming the ambulance company and the pharmacy that she was getting the injections at were inside the Medicare Advantage plan's network, that would be a classic example, Greg, of balanced billing.
And who can help her sort it out now that she's been balanced, or now that she's had this issue? Which one of you guys should she call?
I think Carrie should give a call over to Neighborhood Legal Services.
All right.
Because we want to get to the bottom of this and figure it out.
You want to give us that number one time?
Sure. Our phone number is 800-896-3202.
Thank you. Those of you who just joined us, we've been talking about a thing called balanced billing, and tonight I'm joined with Denny and David, and I know you guys had put together a little kind of a demonstration of what it might look like. You guys want to maybe go through that role play now to help some of the people who might have just joined the call?
Sure, that sounds like a great idea, Greg. So these, what we have put together tonight is an example as well as a small role play about some examples of balanced billing. So let's start with the example. So this is a woman, her name is Ms. Jones, She's 55 years old, and she lives here in LA County. She lives in Torrance. She is on Medi-Cal, and her Medi-Cal plan is with LA Care, and we know that she is an IHSS recipient. So Ms. Jones, 55 years old, lives in Torrance, on Medi-Cal with LA Care, and is receiving IHSS. Unfortunately, after Ms. Jones had a surgery at Torrance Memorial Hospital, she received a bill 2 weeks later from her anesthesiologist for the amount of $400.
This is another classic example of balanced billing, but it's also a very special example of what's called surprise billing. Unfortunately, it's not a happy surprise because you went to the hospital, you thought everything was going to be covered, and poor Ms. Jones ends up with a bill from one of those doctors that treated her at the hospital. So if you're like Ms. Jones and you get one of these bills, what should you do? First, you should know your rights. You should know very well that you are protected from this type of billing. It could be very illegal. You should tell your doctor, in this case the anesthesiologist, that you have both Medicare and Medi-Cal. And you also shouldn't pay for as long as you don't have to pay, because it's a lot easier to not pay a bill than it is to try to get a refund after you've already paid a bill. And if you need some extra help, you should contact an advocate, like somebody in my office, at that 800 number that I gave earlier, and we'll share again soon.
Start again right now.
Sure. I'll do it now. That phone number is 800-896-3202.
So that was an example about Ms. Jones, who lives in Torrance. She's on Medi-Cal with IHSS, with LA Care and on IHSS as well, getting that surprise bill. I thought we could also maybe walk through the role play we have. David and I are going to put on different hats. We're taking off our attorney hats for the evening, and I'm putting on the hat of someone who works at the front desk of Dr. Lee, and David is going to be someone who has both Medicare and Medi-Cal.
While you're putting your hats on, those of you that have just joined us, if you want to ask a question at any time during this call, please press *3 and talk to one of our screeners. And then we're going to try to take live questions in just about 2 or 3 minutes. All right, gentlemen.
Great. Hi, welcome to Dr. Lee's office. How can I help you?
Hello, I've got a 2 p.m. appointment with Dr. Lee.
Oh, yes. You are Mr. Kane?
That's right. Here are my insurance cards.
Okay. Thank you very much, Mr. Kane. I see here that you are on both Medicare and Medi-Cal, and that your Medi-Cal is with HealthNet.
I think so. I'm a Medi-Medi.
All right. Hold on just a second. I'm going to look you up in our system here. Okay. So for this regular office visit, that's going to be $48. And just so you know, Mr. Kane, we accept cash, credit card, and check payable to Dr. Lee. Here are your cards back.
Oh, no. I thought I didn't have to pay because I'm a Medi-Medi. I can't afford to be paying $48 every time I come to this office. I come here so often.
I understand, Mr. Kane. I'm really sorry, but I don't have control over the rules. It's just the way it is. You're going to have to pay this amount before you see the doctor today. I'm really sorry about that. There's nothing we can do. So that's the end of the role play. We're taking our hats off, and we're putting our regular attorney hats back on. And this, I think, is yet another example that often happens. This isn't the surprise bill, or it's a surprise in a different sense, because the surprise is happening at the doctor's office, right? That condition of entering and receiving services is payment itself. And so this is another example of where it's really important to, number one, know your rights. Make sure that you're telling the doctor's office that you're on both Medicare and Medi-Cal if you're Medi-Medi. Oftentimes that telling them will trigger some protections under the law. And to make sure that you don't pay. Now, you should definitely contact David's office and other legal aid offices like David's if you need the help. I think there's difficulty with this kind of problem, right, because it's before you receive services. So with Mrs. Jones, she got her surgery, she came back home, and then she got the bill. But payment was not a barrier to getting services. Here, it's potentially a barrier.
Yeah, and one thing that might help is if you call our office at that 800 number between Monday through Friday, between 9 a.m. and 5 p.m., you can call us from your doctor office. That happens. So I could have picked up my phone and called Neighborhood Legal Services, and an advocate in my office will get on the phone with you and even talk to the person at the front desk and explain your protections about how you don't have to pay.
And sometimes, even though you've told them that you're Medi-Medi, and you think you're saying it the right way, sometimes hearing it from someone else who might be an attorney or some other source could help the doctor's office better understand the rules behind balance billing.
I think that would be so important. I can't imagine if a person really needed the services, really needed to see the doctor that day, and they were turned away because they couldn't pay the $48 copay. Thank you guys for that. Very good example. I remember a couple of years ago when they started Cal Medi-Connect, and they had what they called it passive enrollment, but I felt like it was very much aggressive enrollment. And you would get the flip side of, people would show up thinking they were, still in fee-for-service Medicare, and they'd be told they were in Cal Medi-Connect, and they weren't even in the right doctor's office.
Another surprise.
So, surprise and balance billing. There's a lot going on, and we're really lucky to have you guys here. David, I already forgot your phone number. Maybe you could repeat that again for me, please.
Sure, I've got it right here. It's 800-896-3202.
Thank you.
And the other thing I wanted to add, too, is that, when we're talking about health insurance, it's really complicated. Make sure to have your cards out when you're calling in. But when we were talking about who could be, the biller, who's sort of the possible range of suspects, oftentimes we think it's the fee-for-service doctor or maybe a Medicare Advantage plan. But there are instances, too, where Cal Medi-Connect providers have even billed people in a Cal Medi-Connect plan. And that's, again, something that could constitute balance billing and that you definitely want to seek David's office in helping getting that addressed.
Thank you. Great point. I'm going to ask our second poll question, and then we'll take live questions. So we'll give Julie a chance to line up the queue for the live questions. So the second poll question, for those of you who just are joining us, we've been talking about balance billing, and the poll questions are very simple. I'm going to read the question twice, and then you'll just respond by hitting the appropriate number on your telephone or clicking on the circle if you're following us online. So here's the question. When I get bills from my doctor or other medical providers, I know what to do. I'm going to read that again. When I get bills from my doctor or other medical providers, I know what I'm supposed to do. Press 1 for yes, press 2 for no. One more time with the question. When I get bills from my doctor or other medical providers, I know what to do. Press 1 for yes, press 2 for no. All right. And those of you that answered, thank you very much for that. And let's take some live questions, Julie.
Okay, we're going to go with Barbara.
Barbara,
Yes.
welcome to the call. Do you have a question for us?
Yes. A couple of weeks ago, I received several billings from a service called Ambu Service, and then a week later, the billing manager called me. Her name was Michelle Westick, and she said that I was in a nursing home at the time that these ambulance services was billed, that the nursing home set up the appointments, and I didn't want to go to, I declined about 3 of them, but they said if I didn't go, the nursing facility said I would be, put out the nursing home. So I went to most of the billings, and I got several bills totaling over $4,000. And I asked her, I said, well, why won't you call the nursing home billing department? They said they don't respond. I said, well, how did you get my new address? Because I haven't been where I live for like just 4 months. And so they said, you're responsible. I said, how could I be responsible? Because I didn't know anything about this. And, you know, each bill is like between $400 and $600. It's like 7 of them. So I attached them to the application for the recertification because they've cut my Medi-Cal off. I'm under the Medicare Medi-Cal program, United Healthcare Services, and I think that's under LA Care. So I have a hearing, an appeals hearing, coming up on the 28th, and I just don't understand why I'm being billed for this ambulance service.
Wow, Barbara, it sounds like you have a lot of things going on, and you know, I'm sorry to hear that. I am glad to hear that you have a hearing coming up. And I don't have a clue about those ambulance bills, but probably David or Denny might.
Okay.
Yeah, Barbara, it sounds like you have both, well, you've got at least Medi-Cal. Do you also have Medicare?
I don't have Medi-Cal no more. They terminated that on the 31st.
Okay, so that's another problem. Well,
So
if
I've been paying for my medicine and stuff.
Okay. Well, I'm glad you have a hearing to handle the Medi-Cal being turned off. You should feel free to call our office for help with that hearing. We can give you some advice on how to be successful in your hearing.
Okay.
Regarding the bills from the ambulance company, you should not have to pay those bills based on what we know right now. Those bills are probably illegal. And so I would recommend that you call our office and we can do a full screening to make sure that you don't have to pay those bills.
Okay, I appreciate that. Thank you.
Thanks, David. Now, you know I'm going to ask you to repeat that number again.
All right. I'll do it again.
Thank you.
This one is just for you, Barbara. It's 800-896-3202.
Thank you.
Faye?
Faye, do you have a question?
Hello?
For us? Hi, welcome to the call.
Yes, this is Faye.
Okay.
What happened is I had cataract surgery at Jules Stein, UCLA, 2 years ago, and the doctor is still billing me $770 for a bill, which I have Medicare, Medi-Cal, and I had LA Care, which now I have HealthNet, but they keep sending me the bill. I even sent one to Sacramento. So why do they keep sending me the bill? I don't have $770.
That's a great question. I don't know why they're sending you the bills either, and I think that's really unfortunate. Sounds like you have taken some proactive action sending it to Sacramento, because that's where all this started, or most of it anyway. David, do you have any thoughts?
Yeah, Faye, I just want to confirm everything that I've heard so far. So it sounds like you have an outstanding bill from UCLA for a cataract surgery, and that you have both Medicare and Medi-Cal. You might have been with LA Care before, and now you're with HealthNet. Is that right?
Correct.
Okay.
Correct.
So again, this is another example. If at the time when you got that cataract surgery at UCLA and you had both Medicare and Medi-Cal, this is a classic example of balanced billing. So you definitely want to make sure that you call David's office, the number that he's been saying over and over again.
Right. I have the 800 number. Correct.
Get that kind of help, because this $770 bill, you're exactly right. People who make rules and regulations know that you don't have that kind of money, and so the rules and the law
Of course.
Right. The rules and the law are in place to make sure that you don't have to pay. They're sending it to you because they're probably confused, and we need to work with David's office to make sure that they understand what the rules are.
Thanks
Good
for your
enough.
question.
I will be calling you, David. Thank you.
Great,
Thank
Faye.
you very
I'll
much.
forward to the call. I got one
All right.
extra tip for you. If you don't want to wait to give a call to my office, sometimes, like Denny said, these billers are just confused. believe it or not, they might not know that you have both Medicare and Medi-Cal. So if there's a phone number on your bill and you've got the time and the ability to call that number, you might want to give them a call and remind them about what your insurance was on the date of your surgery.
At the time. Okay, great.
One good
Thank
way
you
of
so
checking
much.
that is that usually on those bills, Faye, it will
Uh-huh.
say what your insurance is, what they have your insurance accepted as. So it'll probably say something about Medicare. It should have both Medicare and Medi-Cal listed. Sometimes
It should
you
have
might
it.
have forgotten one, and that might be one of the reasons why you're getting that bill. But regardless, if you had Medicare and Medi-Cal at the time, you shouldn't have to pay that bill.
Thank you.
Thanks for
Thank
your
you very
call.
much.
Question. Who's next, Julie?
We have Whitner. Hope I pronounced that right.
Whitner, would you like to ask your question?
Yes. I went to a hospital here in San Diego, California, for 3 days around Memorial Day, and I was since then billed. They paid $7,088, and they billed me for $12,088. I'm Medi-Cal, Medicare. My Medi-Cal is a Medi-Cal HMO, and I forgot the first part of the name. The last part of the name is Partnership Plus. I don't know if that will ring a bell as to what's available that ends with Partnership Plus. I'm also legally blind and in a hospital bed right now and can't get up to read my cards. I'm in a hospital bed in my home and can't get up to read my cards to tell you what the full name of the Medi-Cal HMO is. And I had both Medi-Cal HMO and Medicare at the time of the hospital stay, and I'm getting I think this is an example of balanced billing.
Thank you for that. We're always glad to have people from San Diego calling us. Yeah, that sounds very unreasonable, that $12,000. I can't imagine having to tackle that bill. Denny, what are your thoughts?
Yeah, Whitner, thank you so much for calling. It sounds like there's a lot going on right now, and it might not be the easiest for you to call, so we really appreciate you calling in and telling us about your specific issue. This definitely, if you're Medicare, Medi-Cal eligible, you should not be billed for covered services. And so it sounds like we might need to do some work to figure out exactly which plan you're in on the Medi-Cal side. We'll figure that out. We can work with David's office and figure that out. But you should know, you shouldn't be scared. You're not liable for that $12,000 amount.
Do you have help available in San Diego, California?
Yes, we do have help available in San Diego, California. It's not going to be David's office because David is here in Los Angeles, but we can make sure you get the phone number and we can connect you with legal aid in San Diego to get that resolved.
The problem is I can't get up and write a number down or anything right now.
Are you able to answer the phone if someone calls you?
Yes.
Okay, I'm guessing that these guys will be able to work something out. They're really good at what they do. So we'll make sure that somebody calls you, and then we'll figure out the rest.
Okay, great. Thank you so much. My first name is Nani.
Nani, I wasn't even close, was I?
My last name is Whitner. Nani
okay,
Whitner.
That's it. All right. I apologize for calling you by your last name. Thank you.
That's fine.
Thank you for calling in, and I hope we can resolve your issues soon. All right, Julie.
We have William.
William, would you like to ask your question?
Yeah. Can you hear me?
Yes, I can. Welcome to the call.
Okay, yeah. I have a bone disease called Paget's. I don't know if you ever heard of that. It's where your bones decay from the inside out. But last year I had my right hip replaced, and I had to see. Now I have a great hip surgeon, but he told me to see a local general doctor, And I went in the doctor's office, and I asked him, and I had told him, I said, I have Medi. Do I have to pay any copay? And they said no. So I did all the stuff, and they still didn't. At the last minute, the hospital, Palmdale Hospital, called me and said, "You haven't done your blood test yet." Well, I didn't know about the blood test, but to get to the point, I got a bill from them that said I had to pay them $52. So I kept on calling the accounting office in the doctor, Dr. Garrison, and they said, they just kept on going to an answering machine. And then all of a sudden, I got a bill. I had the bill for $52, but then I went to collections. And then this year I'm having my left hip replaced. But I'm not going to that doctor again because I figure he's just, they're full of whatever.
Well, thank you, William, for sharing that. So it sounds to me like the issue is the $52 getting pushed all the way to collection.
Right? No, they didn't answer me.
They didn't from the doctor.
No, they didn't. They never. I kept on calling. I called them about 40, 50 times, and the woman never called me back. And then finally, I called the office and just told them, I said, I don't know why you're giving me this, but I don't think it's nice because I found out that if you have Medi-Cal and Medicare, and I have Care First, LA Care. I don't know what's wrong with LA Care. I don't think it's. I had an epidural 2 months ago, and the place the surgical place that did it told me I have to send them what I get my disability. I have to send them my statement from the bank to get a hardship discharge as well.
Well, thanks for William. We really appreciate hearing this, and it's unfortunate that Dr. Garrison's not returning your phone calls. But if you're still having trouble with Dr. Garrison not returning your phone calls, we can certainly help you with that. And we have your line, your number, and we can have somebody call you back, either David or Denny, to deal with this issue with LA Care and Dr. Garrison not returning your phone calls. Thanks for your call. You have one more question for us?
I do. Carol?
Those are interrogative.
Hi, Carol.
Okay. Imperative sentence gives a command, and it makes a request and usually ends with a period. When the command is given with a strong feeling, it ends with an exclamation point.
Carol. Hi, Carol. Do you have a question for us? Colette, do you have a question for us?
Yes, I do. How are you tonight?
I'm doing great. How are you doing?
Fine. My question is, I have been calling to find out, how to get this paid, You heard of Life Alert USP, where it searches for somebody if they are lost and if they don't know their landmarks and all safety reasons for if you fall or if you get hurt, and it's the thing you wear on your neck, and it's there to push if you're not sure where you are. What I'm wanting to know is, where can I go to have a service plan pay for a bill like this monthly instead of paying it out of your own pocket?
That's a great question. I'm familiar with that type of Life Alert. I think it's an excellent thing to have. I'm not sure if that's covered in a Medi Connect plan or not.
Yes, because I called to Medi-Cal, Social Security. I called everywhere. I called the where you apply for food stamps, the state welfare office, where you apply for the medical plan. All of them refuse, and they don't play it.
Well, Colette, Denny is shaking his head here, so I think he has a good answer for you.
Hi, Colette. Thank you for calling today, and thank you for your question. I'm familiar with life alerts because my grandma uses one, and so I know, I can't say I'm an expert, but I know about them, and I know that they can be expensive. So it sounds like, can I ask if you have both Medicare and Medi-Cal? Are you Medi, Colette?
Not me. I'm doing this because my girlfriend has it all.
So does your girlfriend have Medicare and Medi-Cal?
Yes, they do.
Okay. So if your friend has Medicare and Medi-Cal, one option that could potentially cover the life alert is if your friend enrolls in a Cal Medi-Connect plan. They have these things called care plan options that the plan, or kind of services the plan can offer you that can help you stay in the community longer. In this case, help your friend stay in the community longer.
Okay, how can I get this information mailed to me with the forms?
So the best way to do that is to make sure that your friend calls the Medicare Counseling Service here in LA County, which is the Center for Healthcare Rights.
Oh, okay, for protection of advocacy.
To make sure that they can set up an appointment and go over their Medicare options, because the people over at the Center for Healthcare Rights know about these different options, and they can help your friend walk through them.
Okay, but this is protection of advocacy, right?
It's for getting the life alert paid for.
Right, okay. What's the number for that place?
213.
Oh, wait a minute. 2, 1. Say it again.
213.
2, 1, 3.
383.
383.
4519.
4519. 213 383 4519.
Thank you, Colette.
Good. Thank you, Colette, for sharing that, and good luck. I hope you can get your issue resolved. So we have a couple more minutes, and I wanted to talk about this. I think you have one more thing you wanted to share with us, David and Denny.
That's right.
The 1, 2, 3 bottom line, if I'm correct on that, or?
Yeah, we know we've talked about a lot over the past 45 minutes, and so if there's just 1, 2, or 3 things that you can remember from our conversation, we want it to be these things. First, if you receive a bill, we want you to know your rights. You might not have to pay that bill if you have Medicare or Medi-Cal. Also, if you get a bill, you want to make sure you tell your doctor that you have both Medicare and Medi-Cal.
And last but not least, if you need help, you are not alone in this process. There are people here in LA County who can help you. You should not be scared. It might be a really big amount, but people like David's agency can help you sort out those bills.
Thank you, guys. I was trying to write those down, and I missed the second one. Could you maybe repeat those 3 one more time?
Sure. The first one is know your rights. Know that you might not have to pay every bill that you get. The second one is make sure you tell your doctor about your insurance, whether you have Medicare and or Medi-Cal.
And then last but certainly not least is don't pay that bill. If you have the opportunity, don't pay that bill, because it's so much easier to not pay than to get your money back. And we know how much you need the money.
Great. Thank you, guys. I'm going to ask our third poll question, last poll question, but before I do, I wanted to remind you that if you still have a question, you could press *9 and leave a question, and we'll get back to you after the call. So here goes our last poll question, and I'll repeat it twice. Was this Tele Town Hall helpful? Press 1 for yes, press 2 for no. Again, was this Tele Town Hall helpful? Press 1 for yes, press 2 for no. And thank you again for responding to that question. And again, if you want to ask us to leave a message, just simply press *9. We have a few minutes left. I want to be sure to thank David and Denny for being on the call, and I wanted to give both of them the opportunity to repeat their phone numbers if they'd be so kind to do that, starting with David, who loves to repeat his number.
It's so much fun, so I'm going to do it again. This is the phone number for Neighborhood Legal Services, where I work and other people work. So I might not be the one that talks to you, but please give us a call. We might be able to help. Our phone number is 800-896-3202.
Okay, and one of the things I heard earlier might be a good thing if people carry that number with them, because if they run into an issue at the doctor's office where they're hit with a copay before they're allowed to see the doctor, you said that they could call your agency. In some cases, you might be able to help them.
Yeah, that's right. If it's during normal business hours and you're going to your doctor between 9 and 5, carry our phone number, because if you're at the front desk and they're making you pay and you shouldn't have to pay, call us and we can get on the phone with the doctor and make sure they are complying with the law.
Great, thank you. And thanks again, you guys, for being on the call. And I also want to take this time to thank all the people at PASC who stayed over and are manning our telephones. And I know you guys brought a couple people from your agencies, and I want to thank them for taking the call. We also had some guests from the Riverside Public Authority, and hopefully they were able to get enough information to maybe this is something they'll be able to do. And if Julie and her team, Greg, always do such a, not Greg, but the other, we have two Gregs here. Just like Denny, there's more than one, or like David, there's more than one person working at PASC. They do an excellent job with the tech piece of this, so thank you very much. We have a couple of minutes, Julie. Should we try to take maybe one more question?
Janet has joined us, and she would like for us to give out the 800 number to Center for Healthcare Rights.
Janet, are you on the line?
Yeah, I'm here. Let me give you that number. 800-824-0780.
Maybe one more time, a little louder.
You said I had a few minutes to talk, right?
Yeah.
800-824-0780.
All right, thank you. Do we have time for a question, you think?
As long as it's a quick question.
We're gonna take another question.
Okay, let's do an online question.
Oh, that's a good idea.
If this happens in San Diego County, is there help?
Absolutely, there's help. So a lot of the protections we talked about are federal and state protections. They're not specific just to people in Los Angeles. So wherever you are in California, if you've been faced with this kind of billing that we've been talking about today, there is absolutely help. It might not be David's office because David is here in LA, but there are legal aid offices across the state that would help you with this kind of problem.
If you have Medi-Cal and Medicare, are copays or payments legal to charge the patient?
If you have Medi-Cal and Medicare, are copays legal to charge the patient?
When you're in a doctor office or if you're at a hospital, no, that should be illegal because you have both Medicare and Medi-Cal and you're protected from being billed. But there's one exception we haven't talked about too much. If you're going to the pharmacy, sometimes you do have to pay a very small copay if you're going to the pharmacy for your prescription drugs.
The other sort of exception that we haven't talked about is if you have a share of cost, that you would pay up to your share of cost. But keep in mind that even if you're Medi-Medi and your copay, your card, your Medicare card, sometimes you're with a plan and it might say a copay of $15, but that plan doesn't necessarily address you being Medi-Medi. They're treating you like any other Medicare person. So even if your card has a copay on it, that's not necessarily right.
One thing, we get several questions from people who are Medi-Medi, they have share of costs, and then they try to join CalMedi Connect. So can they join Cal Medi-Connect with a share of costs? And if they do, would they still have a share of costs?
If you meet your share of costs on a monthly basis, so if you're paying out of your pocket to your IHSS worker, for example, up to the amount of your share of costs each month, you should be allowed to enroll in Cal Medi-Connect. But the state hasn't quite figured this out perfectly, like many things. So you can call our office if you're having a hard time enrolling in Cal Medi-Connect.
Thank you very much. And it appears that we've run over, so if I get a bill from, can I call you?
You should know David's number by heart by now.
Yeah, I do. All right. Thank you, everybody who called in, and thanks to all of the people that worked on this call tonight. And we'll talk to you next month.